On a night when most were focused on playoff hockey in Calgary, a large group of area residents came to discuss healthcare in the Lloydminster area. The event was put on by the Lloydminster and District Health Advisory Council. The group shared their 15 main priorities, which include seamless cross-border sharing of health information, improving ambulance service, and better recruitment and retention of healthcare staff. Chair Paul Richer says he'd like to see a full-time ombudsman tasked with overseeing healthcare in Lloydminster.
There's a point where someone's portfolio included all these small communities in Saskatchewan, and it has to do with long-term care, but failed to mention some nearby places in Alberta. That's wrong.
This local doctor says Lloydminster is short about 6 family doctors, and that's leading to overcrowding at the hospital's emergency room.
We do not have an intensive care unit in Lloydminster, and we are 160 miles from Edmonton and 180 miles from Saskatoon, and we do a lot of high-risk surgery here, and some of them we cannot do, and we send people away.
A large contingent from St. Walburg were also present, led by the town's mayor. She says Lloydminster Hospital serves her community, and she sees the healthcare gaps in the region.
They serve a large population, and it seems like the wait times are long. We don't have an ICU unit. There's so many services that could be offered that are not.
Provincial officials were in attendance, including Saskatchewan MLA Colleen Young.
The Lloydminster Hospice has been put back on the books to be re-examined.
Alberta's Assistant Deputy Minister of Health is on the Bi-Provincial Health Committee. He says he hears the concerns.
We've also learned a lot about, what are the strengths and the weaknesses of our health system. Absolutely fair that there's always so much changeover, and so when you have a unique geography like this, there is that greater risk perhaps of the continuity that may not be there. One of the things that we're looking at as a committee is how do we better document the issues. There's been some good work there, and I think we can build on that, but more so tracking of progress, both where there is progress but also where there's not progress.
While there still may be a lot more talk than action at the moment, the Health Advisory Committee is glad to have the support of the community and both provinces at the table. For Primetime Local News, I'm Jace Mackey.